An autopsy report reveals that Friends actor Matthew Perry's death was an accident. He died, though, from the acute effects of the drug ketamine. According to the report, ketamine caused either an acute heart issue or respiratory arrest. Perry, you may remember, was found floating face down in his pool in October. Dr. Sonya Rashid from the Florida Poison Information Center of Jacksonville is joining us this morning. Good morning. Thanks for being here. Appreciate it.
Thank you so much for having me.
So what can you tell us about ketamine?
Ketamine is a drug that is used for a lot of different things. It works on a lot of different receptors in the brain, and there are a lot of different clinical uses of ketamine.
And that said, I know that we've, years ago, it was oftentimes we would hear about something like Special K, maybe as kind of a roofie or a date rape drug. Other things have kind of replaced that over the years. How long does ketamine stay in the system, and what kind of effect does it give someone who takes it?
So that's a really great question. Ketamine doesn't actually stay that long in the system. Depending on how you metabolize the drug, it can stay somewhere between 24 to 72 hours. Compared to other drugs, which may last a little bit longer.
Now, we know because, Matthew Perry struggled and publicly shared his struggles with addiction over a course of several years. He was actually undergoing ketamine treatment to help with anxiety and depression. That was about a week and a half before his death. Would it make sense it would have still been in his system that long ago, given the fact it's only about 72 hours?
So I didn't work exactly on this case, but from what I know about ketamine and how long it lasts in the system, most likely not. So the treatment he got a week beforehand shouldn't have probably been in his blood.
And that said, it's possible here that this could have been an issue of self-medication. That's not uncommon in people perhaps who are struggling with drug addiction. We also know that a drug that is used to help with opioid addiction was also found in his system, but it was not the cause of his death. Let's talk a little bit about self-medication and the dangers of that.
There are a lot of dangers with self-medication, especially with drugs that are really only supposed to be given by a clinician. So for example, ketamine. Ketamine should only be used by a clinician who has experience using ketamine. Ketamine should never be used for recreational purposes or using it on your own at home, just because it can cause you to stop breathing, and the only way to help someone if they stop breathing is by providing them airway support, and really only medical professionals are able to do that.
And in this situation, we know he was by himself, so anything that would have happened, unfortunately, ended tragically. It's interesting, too, because ketamine can be used, as we just talked about, there's a legal use for it.
Yes.
But
yes.
Sadly, because it can be used as an anesthetic, sadly, when one abuses it and uses it, without, being under the guidance of a physician, these kinds of things can happen. Can we talk a little bit? I think that one of the things that we've always worked so well with poison control is the importance of making sure that there's proper storage of medication.
Exactly.
As an example, we've explained the importance of not self-medicating, but let's talk a little bit about that. We've got family members who are coming in,
Yes.
that are visiting other family members about looking at prescription drugs that are in the medicine cabinet.
Yeah, so always really important to keep dangerous medications out of reach of, especially in children. Children love getting into medications. We get a lot of calls about kids getting into grandma's meds. If anything like that happens, always really important to first get medical help, calling 911. But also with us as the Poison Center, we're open 24/7. And our phone number is 1-800-222-1222.
Easy to remember.
Exactly.
Dr. Rashid, thank you for being here. We appreciate your guidance this morning and your analysis.
And again, thank you for having me.
Anytime. We'll be right back.